Hi, I'm Dr. Janine Johnson. I'm a chiropractic physician. I've been in clinical practice for over 23 years. I'm here today to talk to you about diabetes. Now, diabetes, you're diagnosed as being diabetic when your blood glucose level is 127 or higher. And that's a fasting blood glucose level. According to the American Diabetic Association, that should be done 2 times to confirm that diagnosis. 100 to 126 is pre-diabetic or insulin resistant, and 85 to 99 is optimal. Now you may be wondering, why is a chiropractor talking to you about diabetes? And I'll explain that to you as we get into this video. Now when your blood glucose levels are skewed, you can have some serious complications. Blindness, limb amputation, so it's something that you really should take seriously. So how would I help you? How is my approach unique? Well, first of all, I'm not going to look at you under just one microscope. I'm going to look at you under multiple microscopes, and I'm going to assess you metabolically and neurologically. What does that mean? Well, metabolically means we're going to look at your chemistry. We're going to do a complete metabolic panel. We're going to do a complete lipid panel, a complete thyroid panel. Your thyroid gland drives your metabolism. That can be skewed when your blood sugar levels are off. We're going to do a CBC with autodifferential. We can assess your thyroid gland, your adrenal glands. If you have blood sugar issues, your adrenal glands are coming into play. We can check for liver, kidney, gut function. They can all be affected by diabetes. We can also check you for food sensitivities. You can be sensitive to foods that can cause your blood sugar levels to spike, like gluten, which is wheat, oats, barley, and rye. Also yeast, milk, egg, soy. If you are sensitive to any of these foods and you continue to eat them, you are driving your blood sugar levels up and making your problem worse. We can check for your adrenal function. Your adrenal glands sit right above the kidneys, and they release a hormone called cortisol. When cortisol levels are up, your blood sugar levels are going to be up, and vice versa. So they need to be tested. You really need to have that assessed if you have blood sugar issues. We can check your immune panels. There's 2 parts to your immune system, TH1 and TH2. TH1 is the command center, TH2 is the SWAT team. So the command center tells the SWAT team what to kill off. If you have an imbalance in your immune system, it can be caused from an active antigen, which would be a parasite, yeast, fungus, or it could be dysregulation like anemia. We can assess that to see where that problem might be coming from. We check you for H. pylori, which is a bacteria in the gut. That can cause inflammation. Inflammation is going to drive cortisol levels up. It's going to drive insulin levels up. We can check you for leaky gut. If that barrier in your gut is broken down, foods, viruses, particles are getting into your bloodstream that should not be getting in there. It's going to drive inflammation up. It's going to drive cortisol up. It's going to drive blood sugar levels up. You need to know if you have this problem. The only way to know is to be tested. We can assess your neurotransmitters. We can assess hormones. Hormones and blood sugar issues are tied in with each other. And again, we can look at inflammation. Inflammation is going to drive cortisol and blood sugar levels up. So how do we address this? Well, first of all, you need a doctor that knows what to look for, where to go, what to assess, what testing needs to be done, and what to do about it. You need a doctor that's going to look at you under multiple microscopes instead of just addressing the symptom that you might be having. We will not only have you change your diet and stimulate specific pathways to make these changes. It's much bigger than that. It's not just about eating differently and throwing a bunch of supplements at you and you're on your way. The neurological side is that your brain and nervous system need 2 things to function well, and that's fuel, which the metabolic part of this will take care of that, and activation. We can assess your brain and nervous system through a physical evaluation. If we find any kind of imbalance in your brain and nervous system function, we can prescribe brain-based therapies which will help to bring that back into balance. So if you have blood sugar issues, you really need to also have a neurological evaluation, because these 2 things go hand in hand. You have to ask yourself, how has your problem affected your job and your relationships and other activities? Are you dead tired by 1 o'clock in the afternoon? Do you feel like your health is slowly declining? This is what I hear from my patients that have these blood sugar issues. What's it cost you in time, money, happiness? Are you missing out on things in life because of your condition? Where do you picture yourself in 1 to 3 years if you do nothing about your problem, if your problem doesn't get under control? We know that these things are chronic and they're degenerative. So you need to do something about them. And what's it worth to you? You know, people come in, they want change sometimes, but they don't really want to have to give up anything, any of their habits, any of their how they eat. If you are sensitive to gluten and you refuse to stop eating gluten, then I can't help you. You have to meet me halfway. The definition of insanity is doing the same thing over and over again and hoping for a different result. If you want a different result, you got to be willing to do something different. Now, insurance doesn't cover a lot of what I do. So if you want your insurance company to pay for this and you're not willing to take responsibility for your health by your actions through changing your habits and being willing to pay for this out of pocket, then I can't help you. If you want your insurance to keep paying for what you've gotten, you're going to keep getting what you've got. But if you are ready to take action, person that is ready to take control of their health, then I may be able to help you. What I'm offering is for you to come in for 2 free visits. The first visit, I'll review your paperwork, any blood work that you may have had done already. I'll do a neurological screening. Second visit, I'll go over and let you know if I can accept you for care and what would be involved. So feel free to call my office, 231-882-5533. Thank you. I'm Dr. Janine Johnson.